I'm Dr. David Nieves, and I'm a board-certified dermatologist at Windsor Dermatology. One common complaint that people come to our office with is excessive sweating. And we all know that everybody sweats, but for some people, it's more than just the body's cooling off mechanism. It's actually a medical disorder. The cause of this is excessive activity of the nerves, which are controlling the sweat glands. And the name for this condition is hyperhidrosis. Hyperhidrosis can affect the underarm area, and when that happens, people can soak through multiple shirts per day, which can be very awkward for them to walk around with stains under their arms when they don't have something readily available to change into. For other people, it affects their hands, and it can happen when they have to shake hands with a client at work, or when they want to hold hands with the person who they love, or when they take a test and soak the paper while they're writing with their pencil. Excessive sweating sounds like a cosmetic or trivial complaint, but for people who are affected by it, this is really something that has tremendous impact on their quality of life all throughout the day. Fortunately, hyperhidrosis is also a very treatable condition. It can be treated with prescription topical medications that are applied to the affected areas and which occlude the sweat glands so that they don't produce as much sweat as as their nerves are trying to get them to. Sometimes we use topical medications over the affected area, which actually reduce the activity of the nerves that are present under the skin and in the skin, and that has the effect of reducing the overall sweat production in that area. For people who have multiple areas affected or just generalized involvement throughout their body, we sometimes prescribe medicine taken internally, which reduces the activity of those groups of nerves which affect sweat production, and they're able to achieve dryness throughout their body. One treatment approach which often catches people by surprise is the use of Botox. Most people think of Botox as being just for cosmetic purposes, but actually it's FDA approved as a treatment for severe underarm sweating. What I try and do is use these different approaches in combination because different people respond to different things. Sometimes one treatment isn't enough and we have to come up with combinations in order to get people the result they need so that they can enjoy life to the fullest. I think there are a few things that are important for someone to think about who's sitting at home suffering from excessive sweating and feeling it encroach upon their ability to enjoy their daily life. One thing is that this is very treatable, that this isn't normal, that it's really a medical problem, and that there are medical solutions that can really tremendously improve the patient's quality of life. I actually find that the people who come to me who get to seek treatment for this wind up being some of the happiest, most satisfied patients that I treat in terms of the results that they get. I think Windsor Dermatology is an outstanding practice to come to for people who are suffering from hyperhidrosis, because some offices will just offer one treatment or another, or there are some that they don't feel comfortable offering, or some which involve a little bit of extra work. For instance, working with the patient's insurance to get that Botox covered so they don't have to pay for it out of pocket. We have a lot of experience at Windsor Dermatology using all of these approaches. We want patients to get the best possible result, and we'll really work with patients and with their insurance in order to get them the results they need.